Erectile dysfunction is a common problem whereby a man finds it difficult in keeping or getting an erection. Hello GMC family, my name is Nurse Cynthia. If you are new to this channel, please do not hesitate to click on the subscribe button, turn on the notification bell so you don't miss out when I post new videos. And to my returning subscribers, this is Nurse Cynthia saying thank you very much for sticking to this channel. Now, let's head straight to today's topic. Today's topic, we're going to be talking about erectile dysfunction. Erectile dysfunction is very common amongst men. About 52% of men above the age of 50 will have issues with keeping or getting an erection during sexual intercourse. Now, what are the causes of erectile dysfunction? The most common cause of erectile dysfunction is reduced blood flow to the male genital, which is known as the penis. Some people will say, she too spoiled, say she they pronounce penis anyhow. That's why I said the male genital, if that's okay for my online in-laws. Now, talking about erectile dysfunction, like I said, it's most commonly caused by reduced blood flow to the male genital. Now, it could be as a result of vascular disease. Vascular disease, which causes about 40% of erectile dysfunction. Now, vascular disease like hypertension, diabetes, high cholesterol, all of these could be a reason for erectile dysfunction. Now, let's take diabetes as an example. Diabetes causes 30% of erectile dysfunction. It is predicted that the longer you have diabetes, the longer it takes for you to work on, your erectile dysfunction, and also the longer you would have or experience erectile dysfunction. That is because diabetes affects the nerves and blood flow to the penis, both of which are important for erection. That is, blood flow and nerves are important for erection. Now, when there is increased amount of fat in the body, this leads to reduced blood flow. Now, when there is reduced blood flow, it affects erection. Okay, when a person is having high cholesterol, this reduces the blood flow to the penis because the amount of cholesterol in the body is altering the free flow of blood in the body. So, high cholesterol is another cause of erectile dysfunction, which should be treated in order to tackle the issues with erectile dysfunction. Another cause for erectile dysfunction is medication, which is medication for blood pressure. For example, like the thiazide or the beta blockers. For example, the metoprolol. Yes. And also, another medication is medication for depression, like the SSRI, which is the serotonin selective reuptake inhibitors. So this medication causes issues with erection. Another cause is neurological condition, which causes about 6% of erectile dysfunction, especially things that affect the nerve function of the penis. For example, multiple sclerosis, spinal cord injury, and other neurological conditions. 5% of erectile dysfunction comes from pelvic surgery, like prostatectomy, like any surgical procedure that happens around the lower part of the abdomen. 3% of the cause of erectile dysfunction comes from hormonal issues. Hormonal issues like low testosterone, low thyroid, or issues with the pituitary gland. Now, what are the tests to carry out in order to handle the issues with erectile dysfunction? So, if you are having any issues, do well to see your doctor. So, your doctor would likely carry out some series of tests to know how to handle or manage your situation. So, number one test your doctor would likely carry out is early morning testosterone blood draw. This is carried out to know if there is any issues with the hormones like low testosterone. So this test is usually carried out at the early hours of 7 a.m. to 10 a.m. because testosterone level is usually high at this time. So your doctor would want to carry out this test around that time in order to know if there's any issues with the hormones. Based on history or physical cause, Your doctor would also want to rule out psychogenic cause, which is associated with your thoughts and also a contributing factor to erectile dysfunction. And these are usually treated or handled by psychologists or sexual health therapists. Another test your doctor would want to carry out is penile Doppler test. So this test is a non-invasive diagnostic technique that is carried out using an ultrasound to check the blood flow to the penis. Now, like I said, the most common cause of erectile dysfunction is reduced blood flow to the penis. So your doctor would want to carry out penile Doppler test to know if there is reduced blood flow to the penis. So there are many other tests your doctor would want to carry out in order to know how to manage or handle the situation with erectile dysfunction. If you have any more updates on erectile dysfunction as regards to the test and as also regards to the cause, please do well to drop it on the comment section. Your comment may save someone's health or may save someone's life. So do well to drop any comments you have about erectile dysfunction. In my next video, I'm going to be talking about the management of erectile dysfunction. So do well to click on the subscribe button, turn on the notification bell so you don't miss out when I post new videos. To my returning subscribers, this is Cynthia saying thank you very much for sticking to my channel. See you all in my next video. Until then, bye.